to you again. Good afternoon. Hello. Thank you. Ladies and gentlemen, once again, welcome to State House. Your Excellency, President Dr. Ali, Honorable Minister of Health, Dr. Frank Anthony, and P.S. Watkins, Mr. John Hess, welcome again, sir. Dr. Rachel Vreeman, Executive Director of the Mount Sinai Guyana Initiative, and the entire Mount Sinai team, Minister of Finance, and with responsibility for the Ministry of Public Service, and U.S. Ambassador, welcome, ma'am and sir. I'd like to say a special welcome as well to Baroness Valerie Amos, our very own. Welcome, ma'am, to State House. Government officials, special invitees, members of the media, good afternoon once again, and welcome to another historic event. Today's ceremony signals the acceleration of an extraordinary vision to transform Guyana's public health system into one that is world-class, inclusive, and accessible to all citizens. At the heart of this transformation is the passion and foresight of His Excellency Dr. Mohamed Irfan Ali, whose commitment to building a world-class healthcare system is unwavering. The President has made it abundantly clear that development must be human-centered and that every Guyanese, no matter where they live, deserves the dignity of an excellent healthcare. His vision is for the nation where our people don't just survive, but they thrive, where every citizen has the opportunity to live a full, healthy, and productive life. In 2022, the government of Guyana, Mount Sinai, New York's largest academic medical center, and the Hess Corporation embarked on a new partnership to transform Guyana's health system and deliver quality health care to all. In less than 3 years, remarkable progress has been made. Guyana has built the foundation for a more modern health system. Guyana is now poised to become a global leader in health with a digitally enabled health system ready to use advanced technology and AI to provide unparalleled care to all. The progress over the first phase of this partnership has been captured in a new documentary film that will be posted today. The film captures the story of this inspiring journey, told in 4 short stories from the perspectives of those whose lives have been impacted. We are excited to share this short preview of the documentary with you today, telling the story of this visionary collaboration for health. I now direct your attention to the large screen to my extreme right.
Now Guyana is poised to become a global leader, ready to use advanced technology and AI to provide unparalleled healthcare to all. This is the story of a visionary collaboration.
For the Guyanese people, what I would like to see is a healthier population, a population that has equitable access to health care, one in which the health center in the farthest regions of Guyana can have the same quality of service as a healthcare facility in Georgetown, one in which people must have confidence in the healthcare system, one in which the public sector and private sector will collaborate to give the citizens of the country the best possible health care. That is what I think the Guyanese citizen can look forward to. A healthcare system that they can be confident to have their parents receive care from, their children receive care from, and every citizen receive care from. It is developing and building a healthcare system that drives confidence in the minds of the Guyanese people and in the hearts of the Guyanese people.
It's an incredible opportunity to collaborate with the government of Guyana in this way. We actually get to be part of changing a healthcare system for an entire country. That looks like helping the Guyana Ministry of Health to roll out services that are going to transform the health of the population for the entire future. When kids get access to medical services for the first time, as the government is now making possible, when you're able to get diabetes care right in the community where you live, when the national hospital services move to a level of care that really addresses whatever is needed, that creates a whole new set of possibility and opportunity for the future of the country.
The Mount Sinai team is working closely with our partners in Guyana on multiple fronts. First, we are helping the Georgetown Public Hospital improve the quality and safety of patient care and the overall hospital operations. We are also looking to boost specific clinical services like pathology, cervical cancer treatment, to get people access to the care they need faster. Our Guyanese collaborators are driven, and we are already making positive changes together. When all is said and done, we want the Guyanese healthcare system to be stronger than ever.
We hope that this partnership in Guyana will be something that we can look back on and point to the ways in which it's transformed this country forever. We hope that the people of Guyana, that the next generation of Guyanese citizens will have the kind of healthy, productive futures that we all dream about.
Beautiful, round of applause. Good job, good job. I have to say, I can't recall a time I've been in a room with so many doctors. I think it's an apt time for a consult. Our first speaker today is the Chief Executive Officer of Hess Corporation. He led the Fortune 500 company through a strategic transformation from an integrated oil company into a global independent E&P company positioned to deliver significant value to shareholders while safely and responsibly producing oil and gas to help meet the world's growing energy needs. At this time, I'd like to invite Mr. John Hess to deliver his remarks.
Good afternoon, everyone. It's an honor to be here. Seeing that film is very, very touching. Your Excellency, President Ali, Honorable Minister Anthony, Excellencies and distinguished guests, I'm delighted to be here with you today to celebrate this wonderful occasion, along with Dr. Rachel Vreeman, Director of Mount Sinai's Arnhold Institute for Global Health. 3 years ago, Hess and Mount Sinai joined forces with Guyana's Ministry of Health to realize the government's vision for world-class health care for the people of Guyana. President Ali, your vision for the country was truly ambitious to transform Guyana's entire healthcare system, and we are doing just that. The President's vision, coupled with Mount Sinai's world-class expertise and Hess's financial support, have been foundational for a strategic partnership benefiting the people of Guyana. We are incredibly proud of the work that's been accomplished over the past 3 years. It seems just like yesterday that I was honored to be up here to start this initiative. And I would like to share a few highlights. We've rolled out a school-based program of annual comprehensive health exams, you saw them on the film, for children across the country, including vision, dental, hearing, developmental, and speech therapy service. More than 35,000 children have been screened, with about 1/4 being referred for needed treatment. We opened a new state-of-the-art pathology lab at the Georgetown Hospital, excuse me, that significantly speeds up patient diagnoses from 3 months to 3 days, so patients can begin excuse me, receiving life-saving care much sooner. The pathology lab's cutting-edge technology includes remote connection to Mount Sinai's Department of Pathology in New York City, one of the largest in the United States. We've also begun addressing the nursing shortage, with nearly 900 nursing assistants who will graduate in 2025 and join the healthcare workforce in Guyana. Today, we are proud to announce the next phase of our work, Vision 2030, a 5-year plan to provide world-class healthcare to every Guyanese citizen. This plan will include community-based healthcare to strengthen regional systems for primary care and child and youth health. Thank you. A cancer treatment center, this is very important, that will screen and treat breast, cervical, and prostate cancer. A new national women's and children's hospital to provide high-quality specialized care. A digital health system to improve the quality, safety, and delivery of healthcare, and a master plan for human resources, facilities, and finances to underpin the country's healthcare system for future generations. I would now like to take this opportunity to recognize the amazing partnership between the Mount Sinai team, the Ministry of Health, and the clinical workforce here in Guyana. The progress you all have made together is remarkable and a tribute to your talents, your commitment, and your dedication to healthier lives. A round of applause, please. Hess Corporation shares your commitment to improving lives. We believe deeply that our company should be a force for good, and we have a long and proud history of making investments that have a positive social impact in the communities where we do business. It is a core value of our company and supports our purpose, which is to be the world's most trusted energy partner. Our company is honored to be investing in Guyana and to play a key role in helping build Guyana's oil and gas industry. Guyana has made incredible, tremendous progress since our first oil discovery in 2015 and is well on its way to becoming one of the largest crude oil producers in the world. Development of this country's oil and gas resources is important to Guyana, important to our company, and important to meet the world's growing energy needs. Guyana is blessed with so many natural resources, and as I've said before, the greatest are the country's human resources. So providing every Guyanese citizen with access to affordable and high-quality health care is central to the country's future. We're also honored to be investing in Guyana's vision for sustainable development. Through our multi-year carbon credits purchase agreement with the government of Guyana, which we announced in December 2022, we are helping protect the country's vast forests, among the world's largest carbon sinks, and providing capital to improve the lives of Guyanese citizens through investments made by the government as part of its low-carbon development strategy. On my first visit to Guyana, which seems like yesterday, I pledged on behalf of our company to work with the government to ensure that this country's oil treasure truly becomes the people's treasure. It is a joy and a source of pride to begin the next phase of this journey with the government and Mount Sinai to bring world-class health care to the people of Guyana for generations to come. Thank you very much.
Thank you, Mr. Hess, for reminding us of your commitment for the long haul. Our next speaker was previously the Minister of Culture, Youth and Sport from the period of 2006 to 2015. In May of 2024, he was elected the first Vice President of the 77th World Health Assembly. He was involved, or has been involved, in HIV work since 2000 and provided strong leadership in the development of Guyana's HIV program through collaboration with international partners and civil society organizations. He is currently the chair of Guyana's Country Coordinating Mechanism and the Caribbean representative on the UN AIDS Program Coordinating Board. Please help me welcome Dr. Frank Anthony, Minister of Health.
His Excellency, President Dr. Irfan Ali, my colleague in the Cabinet, Dr. Ashley Singh, Mr. John Hess, and the team from the Hess Corporation, Dr. Rachel Vreeman, and the team from Mount Sinai, Baroness Amos, our U.S. Ambassador to Guyana, Ambassador Thiraud, colleagues from the Ministry of Health. Guyana is at a pivotal moment in its history. As our country experiences unprecedented economic growth, we have the opportunity and indeed the responsibility to ensure that this progress is reflected in the well-being of our people. Healthcare is the cornerstone of national development, and our President has not only recognized the importance of healthcare, but has set a very high benchmark. And in his vision, he wants to see us build a world-class healthcare system. He aims to establish a system that promotes wellness, provides excellent community health care, and offer the best hospital care close to home and at no cost when individuals fall ill. President Ali envisions that our population would be screened for the most common diseases, such as diabetes, hypertension, cardiovascular diseases, and cancer, to either prevent these conditions from developing or to detect them early, thus managing them properly to avoid complications. The goal is not just to expand lifespan of every Guyanese, but to enhance the health span, meaning that they should live longer and healthier lives. To bring this vision to reality, he has sought the expertise of Mount Sinai Health System, which is widely recognized for its exceptional standards of clinical excellence and pioneering research initiatives. With a rich history of innovation and a comprehensive approach to patient care, Mount Sinai is renowned for its commitment to advancing medical knowledge and improving treatment outcomes across a range of specialties. Over the past 3 years, our partnership with Mount Sinai has significantly improved patient care at the Georgetown Public Hospital Corporation. We have made notable advancements in the pathology services, as Mr. Hess just referred to, where we now have expedited turnaround times for our test results, reducing it from 3 months to literally 3 days. And we have implemented some of the most sophisticated histochemistry tests currently available globally, allowing for more accurate and timely disease identification. This partnership has also been crucial in drafting a strong data security and confidentiality legislation. These efforts are vital for developing modern electronic health record systems, ensuring that patient information is protected and accessible only to authorized personnel. With a legal framework established, the government of Guyana has begun implementing electronic health records at the Georgetown Public Hospital Corporation and its satellites. The school screening program has also provided health assessments benefiting over 35,000 children across our regions. This initiative not only identifies potential health issues early, but also connects family with the resources needed for further care. With a focus on preventative measures, this program has successfully improved student health outcomes and increased awareness among parents about the importance of regular health screenings. The collaboration has significantly enhanced our human resource capacity and planning, and also in looking at what we'll be doing at the newly established regional hospitals. The initiative has led to the creation of tailored training programs designed to equip healthcare professionals with the necessary skills and knowledge to meet the specific needs of our communities. These programs include workshops on the new guidelines that we have for diabetes and cardiovascular diseases. By investing in the workforce in this manner, the collaboration ensures that health facilities are staffed with well-trained individuals who can provide high-quality healthcare services. I would like to express my deepest gratitude to Mr. John Hess and his company for the investment in this transformative initiative. Thanks to his generous contribution, our vision for a world-class healthcare system is rapidly becoming a reality. He exemplifies the essence of what good corporate social responsibility is and serves as a powerful role model for how businesses can effectively enhance health and well-being and overall prosperity of the nations in which they operate. I want to thank him and his company, and we look forward to collaborating with your team in the next phase of this project. 3 years ago, we embarked on this transformational journey, and today we will sign an agreement for the next phase to continue the progress that we have made and focus on community health, digital health, quality improvement across the healthcare system, developing a world-class cancer care center, increase capacity building for healthcare professionals, and operationalizing the new Women and Child Hospital. This partnership of the Government of Guyana, the Hess Corporation, and Mount Sinai has really been focused on building this world-class healthcare system that our president envisaged. And we know that it would help in the well-being, improve the well-being of all the citizens of Guyana. Thank you very much.
Thank you, Minister. These are indeed uncommon times. Things are changing, we are growing, and we are moving ahead. Our next speaker will tell us more about the key components of the next phase of the healthcare initiative. She is the Executive Director of the Mount Sinai Guyana Initiative, representing the Mount Sinai Health System and the Icahn School of Medicine at Mount Sinai in this collaboration with the Government of Guyana and Hess Corporation. A pediatrician and global health services researcher, Dr. Vreeman is the chair of the Department of Global Health and Health System Design at the Icahn School of Medicine at Mount Sinai and director of the Arnold Institute for Global Health at Mount Sinai. She is also a professor of pediatrics. Dr. Vreeman has more than 20 years of experience scaling up global health innovations to address the world's biggest health problems. Please help me welcome Dr. Vreeman, Dr. Rachel Vreeman, to deliver remarks.
Thank you. Your Excellency, President Ali, Honorable Minister Anthony, our distinguished guests, including Ambassador Theriault, Baroness Amos, of course, Mr. John Hess, our many partners and friends who are here, good afternoon, and with all protocols observed, it's my privilege to talk a little bit more about the future of this partnership. And truly it is an honor to stand before you today as we take these next bold steps together towards the future of health for people in Guyana. Just moments ago, we heard Mr. Hess reflecting on the incredible progress that we've made in this partnership together since we launched the initiative in 2022. Because of the strength of this partnership between the government of Guyana, the Hess Corporation, and Mount Sinai, we are already witnessing a transformation in the healthcare system here in Guyana that I would dare to say the world has not seen before. And today, I am so proud to be able to reaffirm Mount Sinai's commitment to this mission as we extend our collaboration together through 2030. Over the next 5 years, together, we are going to build on this foundation to create together a truly world-class health system here in Guyana, one that ensures that all people in Guyana, no matter where they live, have access to high-quality health care. As Minister Anthony was saying, this is such a bold and beautiful vision put forward by President Ali, and it's truly our privilege to partner with the Ministry of Health in offering what support we can as the Ministry of Health moves this vision forward. And by 2030, we anticipate that Guyana will transform its public health system to have a continuum of high-quality healthcare services in place across each region. Now, as a pediatrician, I do know well that the foundation of lifelong health starts in childhood. And it has been one of the great privileges of my career to see how the Ministry of Health, led by several of the partners here, have managed to roll out already this incredible school-based screening program to nursery schools and primary schools across Guyana. We've seen, as Mr. Hess described, and as you saw a little bit of in the video, how this initiative, which has already reached over 35,000 children in Guyana, provides these comprehensive health exams where we can detect problems with vision or hearing, dental concerns, developmental issues, and then most importantly, connect families with the services that they and their children need so that their children can grow up with this healthy future that you have envisioned for all of Guyana. Now, in collaboration with the Ministry of Health, one of the first things we look forward to in this next phase is how these school health screenings will be rolling out to provide screenings for the secondary school students, even in the second half of 2025. And then as we begin to work together to grow the actual health services that could be delivered directly in schools, again, to keep children growing in Guyana's vision for them that every child in every region gets the care that they need to learn and grow and thrive. And at the same time, we do remain steadfast in our commitment to a mission that strengthens primary care services for every individual in Guyana, whether in Georgetown or in more remote regions of the hinterlands, whether young babies or older people, our goal is clear in this. We want to bring high-quality health care closer to every Guyanese's home. So we are supporting the Ministry of Health and the ministry's efforts to modernize the health centers in every region, to expand the training that the ministry offers for healthcare workers, to put these digital health systems in place, and to improve the quality of clinical services so that both preventive care and the most effective treatments are accessible to all. So looking ahead, our vision for 2030 is one of transformation. Together, Mount Sinai aims to support the government of Guyana with the Hess Corporation and the shared governmental support to reach some really big goals. You've heard a few of them mentioned already, but I am happy to walk through them as well. We look forward to the establishment of a national cancer center, a cancer center that will provide world-class cancer care for the cancers that are right now causing the most deaths in Guyana: breast cancer, prostate cancer, and cervical cancer. This cancer center would reinforce what's already beginning to happen with these life-saving screenings that are taking place in every region, and then to bring that top quality diagnosis and the treatments that are needed right here in Guyana. It's Mount Sinai's privilege to support the launching of the National Women's and Children's Hospital. We envision that this hospital will set a new standard for maternal and pediatric care for the entire region. Together, we aim to strengthen community-based care. We want to ensure that health screenings and quality primary care services really are reaching not only the most remote regions, but also the most vulnerable people within each of those regions as well. We are working together to implement national quality improvements that would enhance patient safety and continue to dramatically improve the quality of care that patients in Guyana are receiving. Not only for Georgetown Public Hospital Corporation, as already we've seen so many improvements in patient care quality and patient safety taking place, but also for the regional hospitals and for every health center and health post where Guyanese go for their care. Together, we are looking forward to creating one of the most advanced digital health systems in the region, and maybe again, even in the world. This digital health system will be built first and foremost on this implementation of Guyana's new electronic health record system, as well as our shared efforts to train up a skilled health IT workforce here in Guyana that remains in Guyana and supports this digital health transformation. And with this kind of data for every person and this kind of digital infrastructure, Guyana's health system will truly have the capacity to use and innovate the kinds of AI and digital technology that will improve how healthcare workers diagnose and treat your health issues. And last, but definitely not least, together we will continue to build and support and train a sustainable health workforce. Together, we will keep supporting the Ministry of Health in their innovative efforts to expand training programs for healthcare workers to ensure that Guyana has the skilled nurses, the skilled physicians, and the healthcare leaders who are needed for the future of healthcare here in Guyana. Now, this partnership is not only about state-of-the-art hospitals and more advanced technology, although those things are absolutely vital. This is a partnership about strengthening the healthcare system to make people first, really led by the vision of President Ali. This means ensuring that a mother has access to safe delivery care when her baby is born. It means ensuring that a father can receive treatment for diabetes before he has complications. It means that your sister can receive treatment for her cervical cancer here in Guyana. And it means that every child can see clearly, hear fully, and get the care that they need to succeed in life. So this is the future that we're building together. Mount Sinai is internationally known and trusted for our commitment to outstanding care and outcomes. And it's our privilege to have the Ministry of Health choose to access Mount Sinai's expertise in these efforts to build a healthier Guyana by 2030. Through this continued partnership, we are not just improving health outcomes in Guyana for today, but we are working together to secure a healthier future for generations and generations to come. So we're incredibly proud. We're proud of what this partnership and what Guyana have accomplished in such a short time, but the most exciting work really does lie ahead. Together, we're going to make history by building a health system that is not just stronger, but truly world-class. And so thank you. Thank you to all of you who've joined us today. Thank you to the government of Guyana, to the Hess Corporation, and many, many thanks to every healthcare worker and leader in Guyana who has made this work possible. The future of health in Guyana is bright, and I cannot wait to see all that we're going to achieve together. Thank you.
Thank you, Dr. Vreeman. Now, our next speaker, two things. Doesn't really require an introduction. He doesn't like long introductions. But I'm just going to read something small. Please. I beg of you, don't get up. His Excellency Dr. Muhammad Irfan Ali has demonstrated exceptional leadership since assuming office. We can all see that. We look around, we see that every single day. With an impressive academic background, including a doctorate in urban regional planning and multiple degrees in business, finance, law, Dr. Ali has played a pivotal role in Guyana's economic and infrastructural development. Again, just look around. On the global stage, he has been widely recognized for his advocacy on issues such as food security, climate change, and sustainable development. And these attributes are reflected here at home. President Ali continues to shape Guyana's transformation and strengthen its international partnerships. Today's evidence. Please stand and help me welcome His Excellency Dr. Muhammad Irfan Ali, President of our beautiful country.
Thank you. Thank you very much, please. Thank you. Distinguished members of the head table, ambassadors, baroness, doctors, distinguished members of the media, all of you, good afternoon. Today is another important day in the transformation of our country, in building the modern, transformative Guyana, in which all of us, I assure you, will be very proud. This partnership, and I love development through partnership, goes beyond Hess, Mount Sinai, and the government of Guyana. The Ambassador of the United States is sitting here to demonstrate that this partnership is also testimony to the strength of the partnership of the United States and Guyana. The very fact that our private sector and our premier medical institution can find the comfort and the confidence to partner with the government of Guyana tells the story of the strength of our own partnership. And I want us to applaud the partnership. Before I go any further, I want to thank, on behalf of the government and people of Guyana, John Hess. John, you have continuously demonstrated your love and commitment to the development of Guyana. You've continuously demonstrated that you're ready to make investments to demonstrate how you feel about the development of Guyana, not only financially, but with your time and personal effort. The last 3 years of collaboration saw us co-chairing the steering committee, going to UN General Assembly week. 1 hours every afternoon is set aside, one afternoon is set aside for a steering committee meeting in your much more expansive boardroom, I must say. Those meetings were long but important, with Mount Sinai, and of course, with Alex and Marcia doing a lot of coordination. The staff of the Ministry of Health here locally, Rachel, supported by Amar and Josue. On our local side, all the doctors, including Robbie, the CEO of Georgetown Hospital, Navin, Fiona, Box, Chandrauti, Sarah, Winsome, Anna, Michael, Lal, Ram Singh, It's December, Hamilton, driving our school program, Saddam from the Ministry of Education, and all the doctors, Sarah, all the doctors who are here, all the support staff. You really should applaud yourself for the work that you have done. The board of directors of the Georgetown Hospital. I am very, very proud of the work our doctors, our nurses and medical professionals are doing in the health sector. Very, very proud of the transformation that is taking place in this sector. Very quiet work, but very meaningful work with very strong results. And we will talk about those results. But today, John and Rachel, I always like to challenge both of you. And only today I challenge them to add one more deliverable on the program for the next 5 years. And because Mount Sinai is such a renowned research and teaching institution, I've asked them to add in the menu of support that we will get a module that will allow our doctors to train on their training platform and their education, continuing education platform. So that we will have this synergy and integration. Earlier this year, I said to the country that before the end of February or January, you will have the electronic system, border system up and running at the airport, and you will have an electronic platform to fill up your immigration form. And as usual, there were the doubting Thomases in our society. I'm very pleased to say that we've delivered that. And in the next 7 months, you will have, for the Georgetown Hospital for sure, and all the other regional hospitals, including West Dem, Linden, New Amsterdam, Lethem, and all the new regional hospitals under construction. In 7 months, we'll have the electronic mobile app through which patients can schedule their appointment at these hospitals. Health updates will be on your mobile phone, and your reminder, your medical reminder on your medication will be available on your medical phone, on your mobile phones. In 7 months, we'll deliver that to the people of Guyana. That is how fast and comprehensive we are working. Now, when you are in government, you're very mindful about what you're investing in. Because when we give this level of accessibility to evaluate the level of service, you're opening up yourself for more criticism. Because if the app doesn't work, or if you don't get your reminder, or if when you go there after your reminder, you don't get the drugs when you turn up, then you're opening up yourself as a government for criticism. And many people would avoid that path. Why embrace a new initiative that opens up the opportunity for greater criticism on the government if it doesn't work? The answer is very simple for me. Our only interest is in the people, ensuring they have greater, more efficient, better service, and that is what matters at the end of the day. Whatever investment is required, whether we are held at a different level of accountability, or whether our healthcare system will be held at a higher degree of accountability, we are ready for that challenge, because our human resource asset in the healthcare system is advancing themselves to embrace these challenges in delivering quality, world-class healthcare to the people of our country. And I do not say that lightly. In the last 4 years alone, we have close to 200 of our doctors specializing. We have been able to expand the menu of services that we deliver at our public hospitals incredibly. Today, we support quietly thousands of Guyanese who require cardiac services. We support hundreds of babies who require specialized treatment. We have been quietly making these investments to ensure that our intention of delivering world-class health care is realized. And I'm confident that with investments we are making, whether it's in research, education, infrastructure, development of our human capital, enhancing our diagnostic capability, changing from clinics to polyclinics, investing in equipment, all of this would allow us to achieve this world-class health care. In addition to the support system that we are putting in place, whether it is the special grant for new babies or the universal health voucher, all of these things come together in creating that ecosystem that would deliver world-class healthcare services. So too is our investment in training and development, having more nurses, more technicians. All of these things are essential. The healthcare system can have the best equipment, the best infrastructure, but if you don't have the human capital, it cannot deliver. And you can have the best human capital, but if you don't have the equipment and the tools to help that human capital, it cannot deliver. And one of the great things about us here in Guyana is that at this point we are at what we call a pilot modeling size. You know, in our first meeting, John had the managementeerist Porter sitting at the table. And we went for 3 sessions, and I see Amar is smiling. Alex, you would recall, after I would have outlined the vision for Guyana, for the healthcare system and every other sector, the managementeerist Porter turned to me and said, "You are very ambitious, Mr. President. The time frame you're setting for these things is very ambitious." And I told him then that I'm not being ambitious, I'm being real. And we'll be able to realize these things. 3 years, we have accomplished every single task we set ourselves in that ambition. Alex called me a few months later, or Marcia, he called, and managementeerist Porter was asking if I was available to take up some assignment with him. So once we push ourselves, once we are bold in our thinking, nothing can stop us. And our size as a country is that sample pilot size that allows us to be nimble in our approach, that allows us to win in every pilot. What do I mean? Because of our population size now, it's going to change, because of our population size now, in many major initiatives, we can be considered a pilot size. And that is what allows that nimbleness in decision making, that nimbleness in management. But none of this can succeed if we don't build systems. System is what ensure long-term success. And this is what this partnership is doing, helping us to build the right systems, the right structure, the right approach. And given our size, we are the perfect test case for robotics, for AI, for digitization, for AI-supported triaging. We are that perfect sample size. But we are not settling to be a sample size. We're embracing the most advanced technology today, so that in another 2 years, you will be in a healthcare system that would be almost paperless. And with that comes a very important aspect of your work: traceability. Traceability of decision making, traceability of treatment. That leads to a higher degree of accountability and holding yourself to higher degrees of responsibility, because everything can be tracked and traced. It's systemic. And that is what we're investing in. Digitizing not only records, but moving to electronic healthcare system that manages the entire ecosystem. This is where our healthcare system is going. Having a common platform through which our specialists can support telemedicine 24/7, linked to specialists in India, Mount Sinai, Northwell, so that we develop an electronic support platform for doctors, whether in the clinics, polyclinics, or regional hospital, so they can have referrals from the level of the doctor that is treating the patient to specialists on a common platform. Integrating AI into your work, your everyday work. This is where we are heading with our healthcare system. So this afternoon, we are not simply commemorating another milestone in our journey towards a world-class healthcare system. We are also reaffirming a vision of a Guyana where every man, woman, and child of this blessed country, regardless of background, regardless of geography, has access to world-class healthcare. A vision where the right to quality medical treatment is not a privilege, but a promise. Not a dream, but a reality in the making. 4 years ago, we embarked on a bold journey. We did not dream small. We dared to reimagine the healthcare system. In 2022, our government, alongside Hess Corporation and Mount Sinai Health System, set out to make this dream a reality. We set out to transform our public health system into one that could stand proudly alongside the best in the world. As I have said before, the process is both quantitative and qualitative. It is not only about buildings and equipment. It is also about improving the quality of service provided. It is about ensuring that when a mother takes her child to the hospital, she leaves with hope, not fear. That when a man gets screened for cancer, he does so knowing that the best care is available right here in Guyana. Today, we're extending this groundbreaking initiative for another 5 years. We are doubling down on that commitment because transformation is not a one-time event. It is a sustained effort. And your government is committed to seeing this through to the end. I want to acknowledge the tremendous achievements made in Phase 1 thus far. And I'm confident that Phase 2 will deliver greater success. But I want to speak a bit about Vision 2030 for the national healthcare system and the steps we are taking to accelerate that process to make accessible, world-class healthcare a daily reality for all Guyanese. And what do we mean by that term of change, by the term of changes which the average Guyanese must enjoy? And I want to go a bit further. I said that our prosperity must lead to the prosperity of the region we find ourselves in. And our healthcare system is being built to support regional citizens and our regional brothers and sisters. We are aiming for a healthcare system that is equal across all regions because excellence should have no borders. By 2030, Guyana's healthcare system will stand as a model of excellence in the Caribbean and beyond. From the coastland to the hinterland, quality healthcare will be every Guyanese birthright. Our healthcare system will become the gold standard for healthcare services globally. At the same time, we will equalize the quality of services across all regions, including between coastland and hinterland, guaranteeing that no patient falls through the cracks and every Guyanese has access to timely, efficient, and cutting-edge medical care. No longer will geography determine the standard of treatment. Instead, we will ensure full equalization of services across all the regions with modern hospitals, well-equipped health centers, and telemedicine networks connecting every corner of our nation. Together, these advancements will ensure equity, excellence, and exceptional care lies at the heart of our healthcare revolution, leaving no one behind. By 2030, Guyana will become a hub for world-class specialized care, from cancer to cardiac care, from oncology to orthopedics, from pediatrics to prenatal services. Our hospital will rival the world's best. Our facilities will offer the latest diagnostics treatments and surgical interventions, supported by state-of-the-art technology and global partnerships. We intend to win the full trust of Mount Sinai and other partners. So by the time we finish phase 2, their stamp and brand will be proudly placed alongside our stamp and our brand. At the same time, we'll transform primary health care and have a strong focus on preventative and community health care. Vision 2030 will see a modern, integrated electronic health record system that would revolutionize health outcomes across Guyana. It will create a seamless, patient-centered network where every medical interaction, from routine checkups to emergency care, is accurately documented and instantly accessible to authorized providers nationwide. This digital transformation will eliminate dangerous information gaps, reduce medical errors, and enable faster, more precise diagnosis by giving healthcare professionals complete visibility into patients' medical histories, allergies, medications, and test results in real time, whether they are being treated at an urban hospital or rural health post. This data-led approach to healthcare will support public health planning. Powerful data analysis and analytics will identify public health trends early, allowing proactive interventions. By securely connecting all levels of care through this digital backbone, we'll ensure continuity of treatment, reduce redundant testing, and ultimately save lives through smarter, more coordinated health delivery system. Let me pause to say that we are also going to work with new technologies in Silicon Valley. We are already eyeing 2 such technology to be the first end user of such technology, one of which deals with MRI and CT scans. CT scans, as you know, you have to use CT scans very sparingly because of the exposure to radiation. Today, there is a new technology under development that does your CT scan without any radiation. So you can do it repeatedly, you can do it as much as you want, so that you can have more constant evaluation of changes. Now, it is also being developed to be much cheaper than CT scans as we know it. These are the same players who moved us to digital X-rays. That is where we are going. We're going to associate ourselves with the best. We're going after the best. And we're going to apply those technology here, so that when we develop this world-class system, it is part of the health economy that we want to create, so that our specialists and specialized doctors would see their career blossoming to the international level by providing services right here in Guyana. This is where we are aiming to be. And we are making all the necessary investments. And with partners like Hess, Mount Sinai, and I want to acknowledge too Northwell, the Apollo Center in India, we are confident that we are going to be there. Vision 2030 will put families first and bring home care to where it matters most. We know that there are a number of families who struggle with assisting their home-ridden and bedridden sick relatives is worth examining. They struggle not only with the expense of providing home care, but also with the medical care and therapy that these family members need. Vision 2030 will empower and support families to care for their elderly and sick at home through community nursing programs, subsidized home care services, all of this to enhance the healthcare experience in our country. And to our health workers, we know the tireless hours that you put into your job. And we are also working to ensure that by 2030, our healthcare system will provide child-friendly daycare services for you, many of you who are women professionals in our healthcare system and still have to carry the great responsibility of supporting your children. These are all services that we're going to integrate into our healthcare service to ensure that you too, the healthcare professionals, that you too are taken care of in this equation so that you can provide the best service every single day of your life. Central to achieving this vision, as I said, is our healthcare workforce. You must be the best trained. You must be paid well and most respected in this region. And I mean that. You must become the most respected in this region. When we invest in our medical professionals, we invest in every Guyanese life. By 2030, healthcare in Guyana will not just be a service, it will be our nation's proudest achievement, guaranteeing dignity, hope, and world-class care for generations to come. None of this will be possible without the power of partnership. No great achievement is ever done alone. Hess Corporation, your commitment to this nation goes beyond business. You have invested in our future, in our health, in our people, and we thank you. To John Hess, on behalf of all Guyanese, as I said before, we extend our deepest gratitude for your exceptional leadership and support in transforming healthcare in Guyana. Your personal engagement in this initiative and Hess Corporation's generous support has been instrumental in turning our shared vision into reality. You have demonstrated that true partnership goes beyond investment, beyond profit. It is about walking side by side to create meaningful change. Through your belief in Guyana's potential, we are building out the backbone of a modern, world-class healthcare system for a healthier future for generations to come. Mount Sinai, your expertise, your dedication, your belief in Guyana's potential has been instrumental in this journey. We are grateful. To the people of Guyana, this is your healthcare system. We express our appreciation to all our healthcare workers and to the people of our country. This is your future. We are building this together. And so, I ask you, let us hold each other accountable. Let us hold each other accountable. Let us ensure that these investments translate into real, lasting improvements in our lives. This is a defining moment. The decisions we make today will shape the Guyana of tomorrow. We are fashioning a future that is worth its weight in gold. We can no longer accept a healthcare system that leaves people behind. Not now, not ever. We will not settle for anything less. Not in this generation, nor in the next. We are building a Guyana where healthcare is not a privilege, but a right. I re-emphasize those points as I would have started. So today, we celebrate this new milestone, and we commit ourselves to further work in holding ourselves accountable to the people of our country and to our partners. We want our partners to know that your investment is one that is not only meaningful, but one that is qualitative in every aspect. I thank you, and may God bless all of you.
Thank you, Mr. President. A vision of excellent healthcare right here at home. And now, ladies and gentlemen, we will transition into the ceremonial signing of the agreement. And I'm going to ask my colleagues to assist me on stage.
Monetary value. I've not added all the other values, including the human capital and all of that. But that tells you the extent to which Hess Corporation, the government of Guyana, are willing to go to ensure that we invest in the health world. Thank you.
Thank you, Your Excellency, Mr. Hess, Dr. Vreeman, Dr. Anthony. Thank you, ladies and gentlemen, for coming today and witnessing and being part of this historic event. Ladies and gentlemen of the media, please, as you are mingling and on your way out, you can please collect a copy of the joint press release from Mr. Danesh Ramroop at the back. And you're welcome as well, everyone, to light refreshments. And I know you haven't seen each other probably in a while and outside of work. So please feel free to mingle. Say hi, let your hair down just for a little bit. Thank you.
Back after 2 weeks. 1 week.